welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. An explanation to why immunotherapies don't work on hardest to treat breast cancers. Thanks to advances in cancer therapies, most forms of breast cancer are highly treatable, especially when caught early. But the last frontier cases, those that can't be treated with hormone or targeted therapies and don't respond to chemotherapy, remain the deadliest and hardest to treat. Tulane University researchers have discovered for the first time how these cancers persist after chemo and why they don't respond well to immunotherapies designed to clear out remaining tumor cells by reviving up the immune system. Patients with heart failure with improved ejection fraction benefit from SGLT2 inhibitor dapagliflozin, according to the study. With modern therapies for heart failure with reduced ejection fraction, acronymized as HFimpEF, some patients can improve their cardiac function during treatment. But despite this improvement in the ability of their hearts to pump, these patients with so-called heart failure with improved ejection fraction remain at high risk for adverse outcomes. Unfortunately, they have been excluded from virtually all clinical trials in heart failure, and there has been little evidence about how best to improve clinical management for this growing patient population. Now, researchers from Brigham and Women's Hospital, a founding member of Mass General Brigham, and collaborators from the University of Minnesota and the University of Glasgow have conducted an analysis that suggests that this patient population may further benefit from initiation of the SGLT2 inhibitor dapagliflozin. This heart failure medication has received attention after presentations earlier this year on data from the randomized controlled DELIVER clinical trial. Multiple sclerosis condition may be affected by gut health and diet. Researchers from Rutgers Robert Wood Johnson Medical School's Department of Neurology have traced a previously observed link between microscopic organisms in the digestive tract, collectively known as the gut microbiome, and multiple sclerosis or MS. Their study in genetically altered mice and people supports the belief that dietary adjustments such as increased fiber may slow MS progression, and they are already working to test the effect of dietary interventions in MS patients. New, safer treatment for serious side effect of bone marrow transplant identified. Researchers at the Tisch Cancer Institute at Mount Sinai have identified a treatment that is effective and safer than the standard of care for a serious and sometimes fatal side effect of bone marrow transplant in cancer patients. Results from a phase 2 clinical trial were presented at the annual meeting of the American Society of Hematology, or ASH. The clinical trial in adolescents and adults found that a drug that inhibits the immune system in patients who have graft versus host disease, or GVHD, is safer than steroids, the current standard treatment. GVHD occurs when the cells from a donor attack the healthy organs of the recipient. It results in the release of certain tissue proteins into the bloodstream. These proteins can be used as biomarkers to quantify the severity of the tissue damage. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.